The Kwara State Primary Healthcare Development Agency has today 26th of February hold a press conference on the commencement of tetanus vaccination campaign. The Executive Secretary, Dr. Nusirat Elelu, while speaking with pressmen at the conference room of the State Primary Healthcare Head Office in Ilorin, said tetanus is a deadly disease that affects the central nervous system by causing painful muscular contraction and spasms through the release of tetanus toxin, and it is caused by bacteria called Clostridium tetani, which the spores of the bacteria is excessively present in our environment. Dr. Nusirat said neonatal tetanus is one of the leading causes of neonatal morbidity and mortality. Dr. Nusirat Elelu in her speech said, without medical care, mortality from NT is close to 100%, which exceeding the 50% even with the hospital care, stating that immunization of women who are pregnant or of childbearing age reduces incidence of NT mortality by an estimated of 94%. While addressing the press, she said, everyone is at risk of getting infected with unhygienic practice. However, said significant progress has been made in the reduction of the burden of neonatal mortality, and still some newborns die every 15 minutes from neonatal tetanus despite the availability of an effective intervention by healthcare centers to prevent such unnecessary death.
Multiple symptoms. The mortality from tetanus is 100%, and that is why that we need intervention. And one of those interventions is the tetanus containing vaccine campaign that is going to hold in Kwara State. So several rounds is recommended, 3 rounds specifically. So Kwara State had the first round in 2019 around October. So we were supposed to have the second round last year, but everyone knew that the COVID-19 pandemic was, the sad and uncertainty. So we had to postpone it to early now. So we're having it in February, ending to March, February 27th to March 3rd. So for Kwara State, a needs assessment to identify the high-risk area was conducted, and we identified 10 local governments with 122 wards that will take part in this campaign, vaccination campaign. The injection is the vaccine is injectable at the upper left arm, and women that are aged between 15 to 49, as well as pregnant women. I know a lot of pregnant women will be aware that at some point they might have been given the tetanus, and this has shown to reduce up to 95% of tetanus deaths. So infection. So it is a very important campaign to ensure that we protect women of childbearing age as well as pregnant women. Thank you.
Dr. Nusirat said in effort to achieve more progress in the maternal neonatal tetanus elimination program in the state, a risk analysis was done to identify LGAs with high burden of MNT, and a 3-round tetanus campaign was planned to reach eligible population. She disclosed that the first round was done sometime in 2019, which the second round of the campaign is scheduled to start tomorrow, 27th of February, and will end on the 3rd of March 2021, which is going to feature 10 high-risk LGA with 122 wards in Kwara State. She stated that the exercise will be taking place at the fixed post and the temporary fixed post. The local government area are Asa, Barutin, Edo, Ilorin East, Ilorin West, Ikwepodun, Moro, Okero, Oyun, and Patiji. She stated that those LG are at high risk of getting infected with tetanus. The target population for the exercise are girls, pregnant women, and women between the age of 15 and 49 years. The injection, which is said to be administered on the left upper arm, after which a card will be issued for them for the subsequent exercise. The officers at each post or temporary fixed post are said to be 5, 1 recorder, 2 vaccinators, the crowd controller, and the child announcer.